Hi, good morning, everybody. I'm Andrew Lau, Lowsutea President. Hey, thank you for joining us because I saw a lot of different people come in from Hong Kong, Philippines, Hawaii, Vancouver, Los Angeles, some South Asian country, which is really good. I think that's super. And actually, that's the reason why I want to talk about distress. And I thought a lot of people thought that, why are you talking about stress? I have a lot of patients actually call me up at nighttime and was telling us that, wow, with the COVID, a lot of the Hong Kong, as you know, recently we have people from Hong Kong has 5,000 people got infected. Oh, no, 50,000. Sorry, 5,000. 50,000 people infected. And many of these people are diabetes and they have serious sickness. And so net result, that became a really detrimental, scary things. And sad part, even the people from the United States was talking to me. They were saying that, hey, I can't see the doctor anymore. Doctor don't want to see me because they worry about COVID. A lot of tests, a lot of things are not able to actually even provided to go update. And so a lot of time when patients are sick, they kind of self-care, and really that's really sad. And same for Hong Kong, because a lot of the Hong Kong people were saying that, hey, I really have no idea how am I doing. I said, why is that? Because I can't see my doctors, and if you're sick, can you go to hospital? I said, no, they don't want to take me either. So because COVID, okay. So all that creates tremendous amount of anxiety. So that became a real issue for many people. Hi， 各位朋友，我係 Andrew Lau Lowsutea President， 你好，係好多謝你哋咧，今日咧就參加我哋呢個講座啦。因為今日咧有啲人喺美國啦、加拿大啦、夏威夷啦、不同地方香港，仲有菲律賓，仲有東南亞國家。咁其實點解我會講下 stress 咧？點解壓力咁大就會對糖尿病有關係嘅咩？其實原來好大關係，因為好多人咧其實咧唔知道咧，原來就壓力咧係令到啲糖上高嘅。咁同埋仲有咧，especially 我哋啱啱香港，我諗你感染過一個咧5萬個5萬個冠狀病毒嘅即係大家喺度執嗰你傳我傳你啦，哇！好大問題出現喎，原來呢個。因為好多人咧就可以擔心啦。點解擔心咧？第一，佢擔心話：哇，係咪到我咧？第二樣嘢咧，好多人咧原本係要睇醫生啊，冇得睇，因為 cancel 咗嗰個 appointment， 因為冠狀病太高，啲人唔俾你入嚟。好多人咧就可以叫 end up 就 self care， 即係我唔知係做乜喎，篤手指，哇！我啲血糖高喎，咁但係血糖高揾唔到醫生喎，就係揾自己嘅醫生，醫生唔想見你喎，哇！咁個壓力好大，所以其實呢樣嘢咧。即係整體咧，我都見到咧，原來好多人就開始話：哇，即係好擔憂，有壓力 stress， 越整 stress 咧，越擔憂咧 ，guess what？ 個血糖就越高。所以今日咧，首先真係要知道點樣去處置啲咁嘅血糖高，因為 due to 呢個 stress 呢個壓力同埋 psychological 嘅問題，即係情緒嘅問題咧。會係影響你血糖嘅，哇！呢個係一個好大問題。咁今日嘅講座就講呢樣嘢咧，所以就會一個係好好嘅幫助你了解，同埋咧，如果你識控制到嘅話咧，咁你幫呢個整體嘅東西係個壓力會降低嘅。嗱，我話俾你聽，呢個係好 serious 嘅。點解咧？我有一個病人咧，即係同我係都好傾得埋啦，咁 share 咗好多佢自己嘅 emotion 嘅東西俾我啦。哇！原來佢搞到自己咧係會覺得我想自殺，即係我要係同佢講下唔緊要咧，你即係唔會有好大問題嘅，嗰啲咁嘢啦。即係我覺得佢哋真係會好驚喎，原來真係會即係諗到哇，我會自殺。咁所以變咗嚟講咧，就希望大家咧至了解就要唔好話以為咦係喎，我就咁即係可以即係咪會自己會處理到咧？未必係 OK。So I would like to share with you some of my just recent experience. As I said, some of my patients who call me and develop a relationship at nighttime, they got so worried. Actually, they don't feel like living anymore. And there was a little thought in their mind that say, maybe I should die. and which is really serious. I thought, wow, hey, that's a real serious. You really need some help. So sort of with the guidance, talking, that was much improved afterwards. But on the other hand, that's something that you cannot take it lightly, because that can be dangerous if there's no one to talk to, and they can really turn themselves into the wrong place. And wrong place meaning they will kill themselves or suicidal. And wow, that is so bad. So you got to really know what to do. Stop that from getting worse, and eventually you might end up to be a corner. That's not good. So before I start, I would like to share my screen and maybe have a little bit review of this is my slide today. Let's see. Okay, hold on. Okay, today, so I will take a little time to just talk about diabetes, so everybody catch up with each other. I know there's some new customer listen to our webinar, might not know much about diabetes enough. So we will just go through a review what we do, and then from there we can talk a little bit more, and then we answer question from the floor. Okay. So 各位同學嗱，今日咧我講座之後咧有啲新朋友嚟啦，咁我就 spend 大概5至10分鐘嘅時間講講咩叫糖尿病啦，咁大家都可以好快去 catch up 嘅。Okay, as you know, diabetic is a chronic disease. You don't get well, all you can do is control. Okay, that is very known. Now, a lot of people don't realize, they say, can I really get well after I do this, take medication? Not really, because diabetic, you cannot get well, and you got to control all the blood vessels not being plugged up by the cholesterol and sugar. They will form plaques everywhere. That's the most effect to your entire body vessels. So diabetes is not just the sugar and the cholesterol clogged up on your blood vessel, everybody, that's where the most important thing, whereby, so you have to control your sugar, so prevent any kind of serious diabetic complication. If you are pre-diabetic, you know what? You are the same. There's no different. And you have to do that. So how do you do that? You have to control your diet, you have to control your exercise, you have to weight management, and then plus you have to measure blood sugar because you have to prick a finger. That's the only way you can do to control, to understand. So listen to our webinar, and drinking Lowsutea will help tremendously. And we'll teach you all different ways, like decrease stress, mental health, all this stuff to help you better manage your blood sugar. So once most important, have to control your blood sugar is always the same. 嗱，各位同友，有啲人未聽過我哋嘅書嘅時候咧，我要大家 catch up 好快。嗱，糖尿病最大問題係咩嘢啊？就係嗰啲糖加 cholesterol 塞住晒，所有血管成身都塞晒，咁你就一定係全身都有好有問題嘅。如果你繼續落去唔控制糖，咁你點控制糖啊？嗱，前期患病同埋糖尿病都一樣，你一定只係繼續控制。控制咧就要將你食啊，要運動啊，要個重磅個 weight management 啊，同埋咧要度血糖咧，知道你幾多血糖咧。咁其實整體咧係有個叫做全個身體嘅 lifestyle 改變嘅。咁就係冇白食 white food 啦，即係食如果飯啊，你食好少啦，就係食多啲菜啦，唔好飲 soda 嘅。咁當然啦，飲血糖係好，飲退糖茶好有幫助嘅。咁最重要咧，繼續係 measure 你一樣嘢嘅，有個 A1C， 將個 A1C 降低6.4以下。So most important, all diabetic and pre-diabetic have remember the number is A1C. Every 3 months, the doctor will measure, or every 6 months, your A1C have to drop below 6.4 to make control. And as you know, everybody go through the same 4 stages. The first stage is when you have high cholesterol, you will add on with the sugar, the cholesterol will damage the B cells, so the B cell doesn't take the sugar into the cells anymore, and more B cells come up. So net result, you have a starting what they call insulin resistant, and the cholesterol continue goes up, and the sugar add together. You know what? Sad part is you're gonna start forming plaques everywhere, your whole vessels. And then tomorrow, next week, we're gonna have a lecture by Professor Jane Young. We'll talk about the eye and show you how these vessels are plugged with cholesterol and plugged up with the plaques everywhere, how damaged your eye, and that will be a good message for showing you that's exactly how it looked like for entire body stucking everywhere. So that will be the most worst damage to your body. And that's why diabetes, this is something that you have to be really worried. And when you have all the plaque, you know what? Your next thing is your blood pressure going to go up, because you know the plaques over here are getting less space, your blood pressure goes up. Now, if you don't do anything, your next phase is your sugar will continue goes up. Then you have measure A1C. A1C is the hemoglobin. The sugar, the percentage sugar attached to the hemoglobin is a small blood cells that carry oxygen. But was one thing nice is also have percent of sugar attached to that. So they measure the percentage of attachment. So usually if you have 5.7, you're normal. But if you're about 5.7, 6.4, then you are a pre-diabetic stage. If you are after 5.7, you are diabetic. So if you move up over, you're stage 4 diabetic. And then after, you continue diabetic, you will not change, and you really have to control, and you have to change your lifestyle to lower it. But unfortunately, once you confirm it's diabetic, you'll ever be diabetic. They won't change the data. So that's something that you have to remember. 各位同友，每個人咧都有4個 stage 去由一開始到第4個 stage 就糖尿病啦。咁第一個 stage 係咩啊？就係當你膽固醇呢個 LDL 壞嘅膽固醇升上嚟啦。咁佢有最大問題咩啊？佢 damage 你個嗰個叫做 B cell 喺胰島素出嚟咧，有個 cell 叫做 B cell， 個 B cell 帶啲糖入去個細胞裏邊。但係當你啲糖咧一路出嚟嘅時候，但係個 B cell 嘅 damage 咧，咁你啲糖入唔到細胞咯，咁啊弊家伙啦 ！You know what？ 嗰陣時咧有問題啦，就係因為咧嗰陣時嗰個繼續啲糖出嚟咧。但係亦都入唔到去咧，因為嗰啲 B 細胞出嚟，咁你開始有叫 insulin resistant， 咁你糖繼續高咯喎，咁但係入到一個第2個 stage 咧，佢糖加埋啲膽固醇咧 ，you know what 個血管咧就會好開始 plug up， 咁啊 plug 咗之後咧，佢就會開始一路全身 plug up， 咁啊弊家伙啦，因為咧你又會血壓開始上高啦，咁呢個第2個 stage。其實呢個睇翻呢個咧，你就知道咧，哇！原來糖尿病係對全身好損壞，就係呢個最大嘅問題出現嘅。咁如果你繼續唔做嘢，你個血糖咧就係有個叫 A1C，A1C 係一個紅血球，紅血球咧就 percentage 係幾%嘅血糖咧係黐咗紅血球嗰度。如果5.7係 normal 嘅，但係如果5.7至6.4咧，6.5咧，你仲係叫做前期患病。嗰6.5咧係糖尿患病者。咁第2個 stage 咩你唔做咧？咁你嘅糖上去咧就開始變咗前期患病。如果你繼續唔做嘢，第4個 stage 就糖尿病啦。咁但係咧變咗糖尿病咧 ，sorry 啊，你永遠係糖尿病嘅。OK， 記住呢樣嘢。咁呢個4個 stage， 咁其實我哋有個好處咧，就有個叫做去糖茶。去糖茶就幫助你咧，第一有個苦瓜咧就幫你同啲胰島素佢increase 咗嗰個。胰島素嘅 sensitivity 帶翻啲糖入細胞裏邊，咁又番石榴葉咧有好處咧，佢就將啲糖係 delay 咗 absorption， 咁嘅容易講就 block 咗啲糖去你個腸嘅血管裏邊啦。咁變咗你兩樣都有嘅時候，呢啲糖少咗喺血管裏邊啦。咁仲有一樣嘢苦瓜有好處喎，佢如果有 excess 嘅糖多咗嘅糖咧，佢尿嗰個掉出嚟，同埋佢掉埋嗰啲咩個 LDL cholesterol， 仲有咩掉埋鹽。咁而掉咗鹽之後咧，個血壓個所以3高都降低，同埋 detox 變咗你個排毒掉晒，咁所以呢個係十分好嘢嚟嘅。So how Lowsutea work is basically the guava leaves. The guava leaves actually delay the absorption of the sugar into the gut vessel, so less sugar going to the gut. But bitter melon has a very effective effect, increase the sensitivity to insulin, so take more sugar into the cells. And then from there, if there's excess sugar, they also take it out from urine, they dump it out, and they also dump out the cholesterol and also dump out salt. When you have 3 of this dumped out, also your blood pressure will come down because less salt, the blood pressure, less retaining water, salt will come down. Plus, it will detox. So it's a magical, really good product naturally because it's not a drug. It's only a tea supplement. It's just a food supplement, basically, drinking like a tea. And then you can able to lower your blood sugar, cholesterol, and blood pressure. Now, if you do not do anything, for example, I don't care. And I tell you, I have a lot of customers actually have the similar attitude. And you took a long time to change that. They said, I'm taking drugs. It doesn't matter. Doc will take care of me. But like what? They really did not achieve the goals. The reason is you really have to make your life so-called a change your lifestyle. If you don't do that, you have an issue of potential stroke. You have the cataract. And next week, we have Professor Young talk about how you could damage your eye. And we have 2 other doctors talk about how to prevent pre-diabetic. And we'll talk about also prevent diabetic complication. So all that will actually affect your entire body. So you're also going to have higher chance of heart attack. You have nerve damage, and that's really bad because nerve damage is damage everywhere. It's not only a nerve damage on the head, stomach, could be your sexual function. And also when you plug out all your blood vessel, your blood pressure goes up, your blood vessel will be damaged. If you got hurt, the circulation bad, you know what? You have to end up chopping your foot. And if you damage your kidney, you know what? You're going to end up with diabetic nephropathy, meaning that you have to do your dialysis down the road. And 30% of diabetic patients have no sex function because they can't feel. There, the nerve damage here. And when you're pregnancy, you can potentially become gestation diabetic, and in the future, you're going to have diabetic problem. And we have a lot of examples of that. So you got to take care of yourself. You have to control your blood sugar. If not, you can end up serious health problem. A lot of people don't realize. You might say, wow, I have no problem right now. I'm healthy. And I have a patient just tell me that too. 53 years old. She was diagnosed with diabetes. At 65, then she realized that, oh no, I'm in trouble. My diabetes is out of control. The doctor said, if I don't do anything, my kidney will fail and I need dialysis. So she took that almost 12, 15 years before she found out that she's in big trouble. That's how long it takes. But once she's in trouble, if she don't do anything, she really end up with dialysis therapy. And that means every week you go to the hospital, wow, all kind of problems. And you know what I mean? And a high medical cost, and really the quality of life will just go down. So you got to really work on it. And remember, in the first 5 years, might have nothing happen, but afterwards you have serious problem coming in. Okay? 各位同學，如果你唔做嘢咧，個問題咧就第一唔係咁大嘅頭啊，但係你5年後咧就可能有嘢出現一個好弊家伙嘅。第一，你可能中風啦。第二，有青光眼咧，睇唔到，開始盲啦。你個腎出唔到胰島素嘅時候，你要打胰島素啦。最大問題咧，有好多人咧就有心臟病。我有幾個堂友已經喺我呢度咧係有心臟病，個原因就係啲糖太高，塞住個心血管，咁啊好弊啦。咁同埋仲有咧有一個問題咧，好多人唔知道原來有神經系統損壞，唔記得同埋咧啲嘢咧個感覺唔到咧，好弊啦。你有腸胃問題啦。有腦嘅問題啦，好多問題出現嘅。咁同埋仲有咧個 damage 個 blood vessel 亦都有好大問題。當你 damage blood vessel 個血壓會上去啦，同埋塞住晒啲血管唔流暢嘅時候咧，傷咗支血管唔流暢啦，囂唔到嘅。咁你要斬咗腳，哇，弊家伙啦！仲有洗腎啦，如果你係個腎跌到係30% 嘅時候，你要洗腎喎。上一次Professor Larry Chan 都講咗啦。所以你一定要注重呢啲嘢。咁原來30% 嘅人咧係冇性功能，因為佢冇感覺啊，佢有個 nerve damage 神經系統損壞咗啦。咁就如果你 pregnant 咧，亦都係要注重呢樣嘢啦。所以咧好多呢咁問題咧，真係要處理嘅。如果你唔處理，有好大嘅問題出現。嗱，我哋公司有個好處咧，就有5個 program。第一，教你去好多嘢咧，就係第一 diet 點做啦，第二飲去糖茶啦，同埋教你做 exercise 啦，仲有教你 weight control 啦。同埋我哋亦都有好多 doctor 即係醫生嘅講座啊，同埋我哋講座咧，日日都加增啲新嘅點樣能夠管理 diabetic management。 嗱，其實呢個好特別嘅咩 fact？我有幾個好資深嘅醫生，佢話嗱，我喺市面上聽到其他嘅公司咧，其實講食啫，只係你咧就講好多咩啊 diabetic management， 即係管理點樣管理 diabetic， 所以好重要就係點 track 啲 blood 啊，咁有制度化呢啲啊，我希望咧能夠幫你 A1C 由10以上一路跌翻嚟呢個5.7以上。So we have actually our company is very unique. We have a 5 proven program to help pre-diabetic and diabetic patients how to manage the diabetes. Now, matter of fact, there are quite a few doctors say, Andrew, you guys doing a very good stuff. You know why? Because majority of people that talk about is all diet, but not talking about total management. So we have over hundreds of lectures talk about total management. Plus, we can answer some of the questions you get asked to help you guys out. And that's become very important because don't forget, diabetes is a lifelong disease. If you do not manage it, you're going to get in about 5-6 years later, you'll be in big trouble. And in order for you to really manage at that time, might not be really helpful, or you can be helpful, only stop at the error, but you cannot get previous improvement because once the damage is damaged. So very important, you got to start now to control. Make sure you lower your blood sugar all the time. You have to exercise. You have to weight control. You have to decrease stress. You have to listen to our doctor webinar to do manage and measure your blood sugar to understand where you at. We have helped many patients with the A1C drop from 10% plus all the way to 6 and 5.7, where a few customers already actually did achieve 5.7. They were so happy. They said, wow, I can able to do that. So that is our goal. Now, certainly, I want everybody to listen, really to set your goal to go below 6.5, 6.5 below. You know what? You have to be at least 6.4 and below, okay? Then you have something to continue to strive at all the time. And yes, it will take effort. I can assure you, it doesn't come easy. It takes effort, okay? Okay, so now we'll talk about how to handle diabetic depression, okay? Now, the reason why I took this topic out is because we have a lot of issue in Hong Kong, I'm sure in Southeast Asia, in Philippines, in everywhere is the same, United States. And I talked to quite a few patients in the United States also, and Canada. And they said, you know, during the time when COVID, if I'm sick in the United States, for example, I can't get a doctor appointment because they don't want to see me because they think I might have COVID, right? And so they really have very little understanding your real actual disease. A lot of times it's I want to have a video conference with you. Okay. And basically, a lot of these come up and they don't even have time to talk to you longer because of the COVID situation. So a lot of time become more and more stressful on all the discussion and all that. So become a really not easy environment, okay? So end up a lot of people start getting fear, depressed, and so forth. In Hong Kong, it's the same thing. That's why we want to talk about this today. 嗱，各位堂友，其實點解我今日會講呢個咁得意咧？係咪真係咁重要咧？咁重視咧？係，因為咧，我係喺香港有5萬幾個人染病嘅時候咧，好多人好驚。同埋你見到好多大所今日講播咗啦，88% 嘅人咧都有長期患病，好多係糖尿患病者係死嘅。咁你話俾幾弊啊？咁好多人咧就話：哇，我想見醫生，醫生話唔見你喎。第二拎唔到 appointment 喎，因為依家個都驚住 covid 啊嘛，咁啊佢唔見你，咁啊睇唔到醫生，咁你自己管理喎，咁你自己 stress 越大啦。咁其實咧呢個 stress 咧係會 affect 咗咩啊？你個 mental health， 你個即係成個心理影響個心理嘅健康啊。咁點解會做呢樣嘢咧？因為糖尿病咧，第一已經係一個好驚嘅東西，好多人哇你係糖尿喎，咁已經係逼到你一樣嘢咧，話要 manage 個 blood sugar 啦，要 manage 我個所有嘅篤手指啦，又要食藥啦，又要管理點樣能夠令到血糖降低啦，哇樣咧好多壓力啊！咁原來咧10至15% 嘅糖尿患病者咧會係真係有個 depression 嘅。咁呢個 depression 咧要真係早啲知道，因為如果越唔知道咧，個 depression 越差嘅。咁變咗越差嘅時候咧，糖尿一路高嘅。咁變咗嚟講咧就係一個 catch-22 啦。咁變咗又有你係 衰咗喺個心理健康度啦，你糖又高啦，咁啊呢個咧今日咧希望呢個 lecture 裏邊咧俾你了解乜嘢叫做糖尿病，能夠令到你個即係壓力好大。咁如果你知道點去解決咗咧，咁你就好大幫助咯喎，係咪？So today's lecture can be very helpful for you. The reason is we have a lot of patients actually working with me, talking to me, tell me, oh, I'm very stressful because I can't see my doctor. And they have really affected mental health. And actually, I can see that's difficulty because a lot of people say, wow, I really said I cannot, see my doctor. I'm very worried. I'm very scared. And on top of that, I have a real problem, because I can't even get appointment to see my doctor. You imagine that? And I don't know where am I at. So all these are really stressful. Now, especially when you first identify you're pre-diabetic, that even also stressful. You know why? Because one, you realize you have a lifelong disease. Second is how it's going to progress from here. And so all those things will add on because now you're going to measure your blood sugar all the time, taking a finger all the time, eating a medication all the time. And you have to continue to drive the blood sugar down. So if you can't drive the blood sugar down, even you get worse because you're going to get scared, okay? And in the study show that 10 to 20% diabetic, they will have a difficulty once they heard about the new diagnosis disease. And many of them, 10 to 15%, actually is because of that, they start develop depression. So in order for you to really quickly control that the symptom so you don't get depressed, because when you're depressed, it creates stress, your blood sugar goes up, you'll be out of control. And you really want to make sure it doesn't affect the mental health. So today, we'll give you all the tips to identify what are the depression look like and what can you do about it. And that has become very important because you don't want to continue depressed. And I had patients that is so depressed, they actually end up saying, I really don't want to live anymore. Wow, I was so scared because I said, you can't do that. So I took a long time talking to them. And eventually they open up, cry a bit, and they feel better. And so they will say, okay, I can now know what to do. And that's so important. Now, keep in mind, when you have stress, you make diabetic management extremely difficult because you know why? Stress increases blood sugar. Now, I tell you quite a few stories because I measure myself using this called diabetic, this thing called Libri, this little gadget. And that's in Hong Kong. And quite a few of my patients have it. Now, I'm right now just had breakfast at 6.8. But you know what? I found that if I'm stressed, and I actually asked some of my patients who use the same measuring stuff, and they say, okay, you're 6.8, that's very good. But I found many of them go as up at 9 because they're stressed, and they have 10 because they're stressed. So it's so important to measure to understand if you're stressed, it does affect your blood sugar. And because when you're stressed, your blood sugar spike up, your blood pressure goes up. Now, I don't know you guys ever measure yourself when you're stressed. I do measure just to test where I am. My normal blood pressure is usually about 120, 125 max. But if I am stressed, my blood pressure go up as 140, 150. Wow, that is going up, boom, 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 okay? My heart rate go up, boom, 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 because you're stressed. And then it also impact your whole well-being. You're going to be all grouchy. If you are really stressed, it disrupts sleep. You don't sleep well. You toss and turn, you have bad dream. And then if you continue to stress, you're going to start getting what? Also bad habit. What kind of bad habit? You got smoking. You have to drink alcohol. You're going to have, if you're stressed, a lot of people eat what they do when they're stressed. Eat. They start eating snack, eating potato chips, all kind of stuff that comes in, which is totally not good for you, blood sugar, because you get potato chips, what happens? Boom, 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 go up your blood sugar. So stress definitely measure by saying that it is bad for you. So make sure that you have to control that stress。OK， 嗱，各位堂友記住，因為咧係好有多我哋嘅朋友咧都知道咧，原來咧當你係好多壓力嘅時候咧，你糖尿病咧管理係一個好難嘅東西嘅。點解啊？因為如果你係 stress， 尤其是我都知道咧，用呢個去度嘅時候咧，我睇到自己咧唔會係喺翻6.5啊嘅東西嘅，你會上咗去咩啊？哇，9啊，有可能有啲朋友話俾我聽咧，如果係 stress 咧90都有嘅，所以其實咧係好重要嘅知道咧，如果你係好即係壓力好大咧，其實影響你血糖好多。點解會咁咧？就係因為你 body stress 嘅人咧就係哇，我俾糖你準備打仗。咁你嘅糖就升咗上嚟，你個身體全身都做多啲糖出嚟咧，幫助你準備你打仗。咁你就 stress 就弊家伙啦，你唔想啲糖上嚟啊嘛。咁你一定要減翻啲壓力咧，先能夠降低血糖嘅。咁仲有咧 stress 嘅時候仲有咩啊？你血壓會上升。我自己係㗎，因為我度過咧，如果我好 stressful 嘅時候，血壓上到150度嘅，可能哇，我近時係120度啊，點解會150度啊？所以呢個唔係好嘢嚟嘅。你 heart rate 亦都上嘅。boom boom 110度110或者105會 stress 嘅，因為會 heart rate 上嚟啦。咁同埋咧，仲有咧，你會自己好猛震嚇，你個成個人好緊張。咁你個時候咧，你就成個 emotion 嘅心理咧都好大問題嘅。咁仲有，如果你好 stress 嘅時候，瞓覺瞓唔到，你冇好嘅睡眠，點解咧？你 toss and turn 去喺呢度去下嗰度咧，就發惡夢啊，因為好 stress 啊嘛。咁所以整晒咧都係令到你唔係一個好東西。仲有一個問題，當你 stress 嘅時候，多數我唔知問下你自己，我諗你都係㗎啦，我都會係嘅，但係我就知道自己控制嘅。當你 stress 嘅有個問題咧咩啊？你要食嘢啊，食咩 chips 啦，食飲酒啦，食煙啦。當然我冇呢樣嘢，但係我會食嘢，食咩啊 chips 啊嘅東西咧，或者食其他嘢啦 cookies 啊，又係咁照，因為你 stress 嘛。所以咧，當我 stress 嘅時候咧，我唔擺呢啲喺度嘅，因為擺喺度咧，我好快就撳一聲走嚟食。所以呢啲咧係好大嘅管理嘅糖尿病問題。所以記住 stress 係會影響你整體嘅血糖高嘅。So keep that in mind when you are stressed, you gotta relax yourself. If not, it will hurt you because the blood sugar will continue goes up. Your average blood sugar on that day when you're stressed will go up as high as maybe 140, 150. 160 or even 200 because of that. And my friend have this in the US. I asked them if you're stressed, they measure yourself. They were shocked. They would say, wow, I didn't know my blood sugar will go up to 120. From 120, go up to 180, 190, 200. So that's how far it goes. In Hong Kong, you know, we are basically a 6.5 will go all the way to 10 or 12. So you don't want to be in that boat, okay? So remember, stress affect your blood sugar. You gotta be careful. You don't want to do that. So, to control your pre-diabetic, diabetic, besides drugs, unfortunately, you gotta change your lifestyle. Now, I talked to a lot of my customers. They said, well, you know, I went to doctor, I paid them a lot, especially the private patients. I paid them a lot to give medication. I should be okay. I just depend on medication. Is it true? No. If you don't change your lifestyle, even though you get more and more medication, it might not necessarily bring your blood sugar down. So don't think that just depend on medication will make sure your blood sugar is always good level. Now that concept, in a sense that some of my customers are fairly wrong because they said, I take my drugs, I'm good. I will be able to control my blood sugar. But unfortunately, the reality is not necessary. You have to really control by the whole lifestyle change. When you do that, you take less drug, you have better blood sugar, you're healthier. I'll give you one example. I have a restaurant manager who is, you know, he is pretty good and had a very so-called colorful lifestyle because every day he ate a lot. Every new dish he would try, and he become very, you know, happy instead because I try all the expensive food. Unfortunately, a few years back, his stomach is start getting bigger and bigger. His weight is going to control bigger and bigger, and then he become heavyweight. Eventually, become diabetes. and become diabetes because he had money. So he said, well, don't worry, I will take medication. So he go to a private hospital, get medication, and he said, Andrew, I already paid this guy so much money. Why can't I just take my medication to get better? So I said, look, have you measured blood sugar? Well, yeah, I did. And I realized it's not well controlled. His blood sugar is always 10 and 11 and up. I said, if you cut 10, 11 up, meaning you have 200 and up, 200 milligram per deal is high. All the time is bad for you. In other words, his A1C will be 10 and 11, 12 above. So imagine that. That is not good for you. You don't want to be at that boat because in short term, you might not feel it. In long term, meaning in about 2 to 3 years, you're going to have all kinds of problems to come about. And it's too late because at that time, you can't reverse it, okay? So don't really just depend on your drugs. And most likely, you got to change lifestyle. It's not most likely. It is going to need to change your lifestyle. And suddenly the doctor usually say, wow, you have to control your diet, stop eating sweet, avoid alcohol, avoid sugar. Yeah, you can do that if you can change your lifestyle. But a lot of people don't realize you also need to change by getting exercise, weight control, track your blood sugar, prick your finger daily. And then you can also, if you are out of control, you might have to actually inject insulin, and all the stress that come in together is also create emotional reactions. So all the stress, okay? So medication might not necessarily bring down your blood sugar. Keep that in mind, okay? 嗱，各位堂友，我講個古仔俾你咧，我有個經理朋友啦，咁佢就話：喂，我係睇私家嘅喎，我亦都咧係揾我醫生嚟睇，佢係俾咗好多藥我食，咁我一定會好㗎。點解唔好啊？因為佢其實一個呢個高級經理啊。咁佢係好正嘅，因為佢幾年前咧就日日有啲新產品食啊，哇！佢一路咁肥，一路加磅，佢肚腩越嚟越大。咁弊家伙啦，咁佢幾年前咧就已經做咗糖尿病啦。咁佢話：我點解唔得咧？我話我依家係猛食藥嘅啫喎。咁但係當佢該溝通嘅時候咧，原來咧佢自己嘅 lifestyle 冇 change 到嘅，佢喺度肥胖，個肚腩越嚟越大。咁弊家伙啦，因為佢依家咧其實已經係。佢糖尿係控制唔到嘅，因為佢 A1C 去到10幾以上嘅啦。佢個 average blood sugar 咧已經係去到10啊、12啊、13啊呢種分。我話你繼續落去咧，你會有好大病出現嘅。咁其實呢個整體講嘢咧係一段好長嘅時間，佢先 realize， 哇！咁係咪落去唔得㗎？咁即係佢覺得自己我依家生活都幾好啊，我食乜都得啊，我就食藥得啦。咁其實食藥係唔得嘅，記住食藥係唔得嘅。你一定要生活習慣都要改變，要食咩咧？要生活要 diet control 啦，即係你個 low carb diet 咧，低嘅碳水化合物食物啦，要做 exercise 啦，要 check 你個pick 你個 finger 去 measure blood sugar 幾多啦，同埋仲有咧，如果你真係 lost control， 有打胰島素啦，同埋咧你要真係唔好 create 咁多 stress 啦，因為 stress 繼續係 increase 咗你個 blood sugar 同埋 emotional。呢 reaction 都好大嘅。咁呢個朋友咧，佢雖然係一個好即係好有錢啦，可以講得為，同埋佢生活係好正嘅，即係酒樓老闆啊，因為佢都有股份啊。咁但係 on the hand 咧，佢個問題咧，佢個生活習慣全部改唔到咧，淨食藥咧係會第時害咗佢。咁佢依家先最近咧係 realize， 哇！呢樣嘢咧唔得㗎喎，我係要改變生活習慣喎。咁依家先慢慢改啦。咁其實咧，呢個已經係 first good step。因為如果唔係咧，佢會係3、4年後咧，佢會係有 heart attack 啦，可能個腎壞啦、腦出血啦，哇，好多嘢出現嘅。所以呢個係一定唔好以為淨係食藥係咪能夠會醫到你？唔係，仲要 lifestyle change。嗱 ，so imagine you now identify yourself as a diabetic or pre-diabetic. All those stresses start coming because you say, wow, what will happen to me? And would I get worse? And so forth and so forth. So everything that comes into you, you're going to start realizing that might be scary. And eventually, you gotta if you don't, keep worrying and worrying, you might end up with get depression. So stress can lead to depression. And important to recognize that though what is a sign of depression, and that's what I'm going to show you today. And you got to remember some of the signs. Hopefully you know about this and get to know that and get a treat early. Now I tell you, because you will be living with diabetic for lifetime. It's not like 1 year. It's not like 2 years. A lifetime. You will live with your diabetic forever until the day you die. So you will be the one that continue to manage until to control your diabetes. And you really have to find a doctor, not only treating you for your diabetes, but also recognize how can help you on mental health. Make sure that if you get depressed, you have someone who are professional know how to handle your mental health to help you to prevent the depression. And that becomes a very important sort of structure yourself and make sure that you have the support. Now, 各位同學記住，因為壓力大咧係會令到你有可能咧有個叫憂鬱症嘅。嗱，因為首先第一，當你知道哇我係前期患病咯，咁啊第時我會變咗糖尿病咯，咁我唔知點算咧，我會係有病得好慘咧，呢咁嘅顧慮啊，慢慢咁就加埋你身體上不同嘅問題出現啦，仲有咩咧？仲有其他嘅地方。好似 COVID-19 啊嗰啲又出現喎，咁又加多壓力喎，咁你會好多嘢加埋嚟咧，咁你就會覺得哇好壓力好大啊，咁你就開始有可能咧 develop 呢個憂鬱症。咁但係呢樣嘢咧，你一定要知道早啲 recognize， 早啲即係了解，哇呢個係憂鬱症嘅 symptom 嚟嘅喎。咁我哋知道咧點去就係要處理啦。第二，記住糖尿病咧係一世嘅病嘅，即係你係會繼續咧。永遠都同佢一齊，同佢生存，一齊生存啦，糖尿病。咁你一世去到死嗰日，你都係有糖尿病嘅。咁所以變咧，你一定要繼續幫助你自己點去處理，令到你唔會嘅差嘅糖尿病。同埋你仲要揾啲醫生咧，係識去醫你咧。如果有情緒嘅問題咧，可以醫到你嘅。咁呢個係一個好重要嘅部署啊！呢個部署咧，你要有呢個。部署幫助你咧，係有呢個 support 支持你如果你真係有 depressed 嗱，I would think that it's good idea you take a picture of this one because you know why? This is the typical sign and symptom of depression 請各位同學影張呢個相啦，因為咧好多時咧你太多嘢睇到出嚟，呢個係可能係會有 depressed 嘅喎 ，so this is a picture that you need to know that you have to, if you find some of these symptoms, then you might need to start early looking for help. For example, depression will be feeling empty inside. Wow, I don't know what to do, man, And a lot of people actually feel guilty because I'm diabetic, shit, I'm diabetic. They feel real guilty. They feel real sad internally. And they feel hopeless, despair. Oh man, I'm diabetes. I never get well. I'm gonna die. And that would be terrible. And many become so depressed, they don't feel eating. They don't eat. They feel, look at food, they have no appetite. And worse, that a lot of people cannot sleep, insomnia, because they keep thinking about the disease. What happened? And if you have insomnia, you know what? That also affects your blood sugar because you can't sleep. You're gonna get stressed come along. And then a lot of people, some people just sleep a lot because they don't feel like doing anything. They're depressed. They don't feel anything. They will sleep a lot. So with that, they feel lethargic. They don't feel energy anymore. They don't have energy. They don't feel like doing nothing. And also because they are depressed, and this is a very common symptom is they can't make any decision anymore because they're depressed. And they will just kind of stand still, don't know what to do. And some of them also have total irritability. In other words, they feel little thing, they will be very irritable and they will blow up and they will have a lot of anxiety. And they also have ache and pain and they have digestion issue. And they also, at the end, they will have suicidal in the mind, and they want to die. Okay, and I tell you, quite a few customers actually talk to me, and I need to really get them to talk to eliminate that suicidal in the head. So they will say, hey, you do have hope. Okay, don't worry, we'll help you together to go through these difficulties. Okay, so those are all there. And I will tell you one example. We have a patient, actually this is told by the doctor to me, and he keeps saying, he's a diabetic, he keeps saying he have stomach problem, the pain problem, or the back, and you know, the doctor looked through everything. It really doesn't have much problem in a sense clinically. But you know what? All those is because the depression and stress create all those psychological things to keep his stomach pain, back pain. And so they basically treat her, this particular patient, decrease the stress, decrease the depression. You know what? The pain go away. So that is really, all these things can affect, because depression was this sign symptom. And you really have to have people like who knows, it's not the, may not be family medicine. It could be an endocrinologist to help you to understand or refer you to a proper, you know, psych help, to help you to talk about your emotional problem, to help you become, you know, recognize your stress and recognize your depression. So that is important. That's why I want you to take a picture. Okay. 嗱，各位堂友，我曾經叫你影張相嘅原因咧，因為都好多 sign and symptom 嗰度，即係好多人咧有咩症狀出嚟咧，係會有呢個憂鬱症咧咁。嗱，第一，好多人咧有憂鬱症嘅時候覺得好空虛，感受咧好似哇死啦冇晒嘢，好多人亦都有內疚，非常感覺咧就好傷心嘅，同埋咧覺得好似絕望啊！哇！呢個先大問題，絕望啊！唔記得，如果你絕望咧，你就唔好想做嘢嘅，你又唔想食飯嘅，咁你又成日瞓覺嘅，咁亦都好多人咧瞓唔到覺嗰啲又會失眠嘅，咁亦都覺得頭頭暈暈啊，好難解決方法啊，又唔會 make 到 decision 解決啊，咁亦都有啲人咧又好嬲嘅，因為佢話哇咁搞錯係我，有啲人 deny 嘅，有啲話唔係啊，唔應該係我㗎，點解會有我咧咁嚇？咁亦都有好多焦慮嘅，同埋有啲好驚 ，OK？ 咁驚嘅時候，好多人咧就會話我肚痛啊，腰骨痛啊。咁其實我應該話俾你聽，我有個病人咧就係咁啦，因為佢醫生呢個係醫生話俾你聽，佢有病人咧，佢成日話佢有肚痛、腰骨痛，其實佢睇唔到有咩令到佢係咁嘅，但係其實佢因為係 佢 depress 同埋佢有 depression 出現，咁佢就用咗即係個身體指話咧，我有啲咁嘅痛。咁最後咧就揾咗即係心理學醫生啦，睇咗之後咧管理咗呢樣嘢，咁佢個肚啊同埋腰骨都唔痛啦。咁最後好多人咧就會係消化問題啦，同埋仲有最弊咧自殺，呢個咧係一定要處理嘅。如果你俾個 depression 繼續落去嘅時候咧，個自殺觀念咧一路上嚟嘅時候咧就弊家伙啦，佢真係會 end up 自殺嘅。所以我咧都同好多病人咧開解咗啦。咁原來佢講晒之後咧，咁就了解到，即係有即係半個鐘頭開解咗佢，俾到有一樣嘢好重要，我俾一個 hope， 俾一個希望佢。我話你一定會好嘅，因為如果你控制到咧，你就見到佢個糖會跌落嚟啦。咁呢個咧就幫助佢呢個好大嘅，因為如果唔係咧，佢真係越整越我冇 hope 啦，我會死㗎啦。我會好差㗎啦，咁佢呢個咧就會變咗一個唔好嘅東西啊！記住啊，咁記住咧，呢個影翻張相，因為呢個係有對你嚟講，將來要 identify 你嗰個即係憂鬱症咧，呢個係一個好有幫助。So 如果有呢樣嘢嘅時候，一定要去睇醫生，因為自己醫唔到嘅呢個啊。咁同埋咧，遲啲我教你哋都會點去 get 多啲 support 嘅東西。OK，so keep that in mind. Make sure. When you are depressed, take a picture of this because this is all the typical symptom of a depression. Now, one of the things that is also there's stuff that called diabetic distress. Now, diabetic distress is basically you develop the feeling of despair, you know, like, wow, I'm hopeless now because of diabetics, okay? And this is a problem that comes on if you don't take care of it, you will basically end up with real strong depression. Now, because basically what happened is a diabetic will say, wow, I lost control of my diabetes and I take all effort come out. You know what? It's not working. My blood sugar kind of goes up, and instead of I controlling diabetes, the diabetes control me. Oh, that would be terrible. And they create, all kind of problem come up because of diabetes. I mean, health problem I'm talking about. So it's no longer just the blood sugar now. It's going to be also heart, could be the eye, could be kidney, could be my very common is nerve damage, whereby they will have all kind of problem comes on. So they will have all kind of condition. They will feel tremendous despair, and they might start giving to say, gee, I really give up. I don't want to see doctor anymore. And so net result, they further moving far away from the actual reality. In other words, they could be treated, but they won't do it because they're so stressed and they are so despair. And because diabetic patients, the mental health continue to develop, they will get depressed, they will further anxiety. So with that, you have to focus to treat your diabetes. And that really need to have a doctor to understand this. You are diabetic distress and continue to treat you on the issue of distress and make sure you don't go to severe depression. And that's very important. Okay. 嗱，有個糖尿病困擾咧係一個好大問題嘅，因為你全部都嘢都喺糖尿病開始做出嚟咧，你就開始佢好多絕望嘅感覺啊！點解會絕望感覺咧？因為第一啦，你又會你要糖尿病要控制好多嘢啦，啲糖要跌落嚟啦，但係好多時咧覺得喂控制唔到血糖喎，依家糖尿病控制我喎，弊家伙啦！咁同埋仲有咧，好多糖尿病者咧開始出現有其他嘅問題。眼嘅問題啦，可以蒙啦；心臟問題啦，可以壞嘅心臟啦；血壓嘅問題啦；腎嘅問題啦，同埋仲有咧就係仲有咩神經系統嘅問題。咁神經系統問題咧，好有問題咧，就好多時咧佢感覺唔到啊，或者有好多痛症出現啊，好多嘢好煩嘅東西。我其實都有幾個呢個糖友咧出咗現咧，就係佢個腳啊，只一隻腳啫啊，可以起泡嘅。腳眼嘅起泡，咁起泡之後咧就唔會好，好難好。咁呢個咧係好煩，因為佢着嘅鞋又痛啦，行路痛啦，仲有咧就係唔好啦。咁變咗係令到佢成個人咧係好頹喪，好 give up。咁我哋要好講咧，嗱，即係要話咧唔好俾佢發炎啊，因為如果咪趕咗腳啊，咁佢都驚到震啦，係咪？咁最弊咧就係即係呢啲咁嘅嘢咧係令到好煩，所以其實咧呢啲咧就一定要。教佢哋咧，第一，喂點控制血糖啦，make sure 咧佢係繼續肯去醫啦，因為最弊如果 give up 咗咧 ，you know what 你唔醫㗎啦，你唔去睇醫生，亦都話算啦，哇咁啊弊啦，因為你一路做咧，一路仲要衰落去嘅，同埋你個糖咧，即係你要繼續高嘅，咁啲人咧就會開始越整越驚，越 depress， 越 give up。咁其實咧呢個咧係一定要做一樣嘢係 focus 去同佢。搞掂咗佢糖，咁佢啲嘢就自然好噶啦。咁所以變咗咧，又幫佢搞掂糖啦，仲要咧係有個啱嘅醫生咧喺佢即係精神上嘅管理啦，同埋佢醫療上嘅管理，幾樣嘢一齊嚟先可以做得到。咁呢個Diabetic Distress係一個問題，重要問題㗎，所以唔好忽略。OK，Imagine make sure Diabetic Distress is a real important issue. And you can't ignore it because all that is the distress came from what? Diabetes. If you treat the diabetes, you know what? Then the distress will disappear. So it might be a simple thing, maybe just a blister on the foot. That can be really terrible because you get pain, or you might not pain. You're going to start getting worse and worse. And if you don't treat it well, you know what? That becomes a gangrene. You have to end up cut out your foot. So you gotta take aggressive action to do it. So you gotta be really on top of it, right? So net result, that you don't want to give up. No hope. That's terrible. Don't let that happen, okay? Now, some other confusion. when your blood pressure goes down. Now, if your blood pressure high or low, especially low blood pressure, you also feel really hopeless because you feel tired. I don't feel like doing anything. And so it looked like depression, but it might not be depression, but it's just because of blood pressure issue. So you have to talk to the doctor, say, hey, what happened to my blood pressure? Is it real? My blood pressure is like that. So with that, then you can understand, wow, okay, maybe it is something is not my depression, it's just the blood pressure. But that is so much things you have to talk about. You need to really check, got doctor to check with you about what is the body cause you below or high blood pressure. 嗱，好多時咧，有啲人咧係血壓高低咧，都好似 depression 一樣。如果你血壓低咧，你冇晒精神嘅，喐唔到嘅。咁所以咧，你就會 actually 咧就未必係 depressed， 但係你呢個要需要你自己咧去幫助你了解點解你有呢個血壓高或者低嘅問題咧。呢個咧你就要揾醫生咧 check 你個 body， 你個身體上有咩醫治，係咪有能夠點解令到血壓低嘅 ？OK。Now, keep that in mind, when people are depressed, especially diabetic, sometimes it's difficult for the doctor to diagnose you are diabetic depression or you are getting depressed. The reason is because the people are depressed. They don't want to go to see doctor. They are scared to go see doctor. The reason is because they worry about, wow, the doctor will give me typical diagnosis that will be very scary, tell me how bad I am. So they really said they worry about treatment, they worry about financial issue, overhaul, health costs, also all the other eye organ involved. So with that, they are really become an item that it will be hard for them to face. So that become a sign, getting back to a possible depression. So very important. You have to recognize you are treating a diabetic patient. If you have diagnosis, the depression might not be as easy as you think because they don't even want to see the doctor because they are so depressed, so scared. They don't want to go there. So the family might need help because you need to talk to your family to tell them, hey, man, mom, you have to go see doctor, okay? So these are the things that you have to watch out. And we have to really, at the end of the day, you have to maintain a positive attitude to basically you say, hey, I do have hope. I can control this. I can make choice to treat my diabetes. Now, if you only have negative emotion, that's okay too. You're angry and guilt. But the important, if you have positive attitude, even your angry emotion, I'm saying, I'm diabetes. But if you're positive, say, okay, I will go there and fix it. Even though you're angry, you're guilt, but because you're positive, you're going to set goal to improve the situation. So that will be okay. The worst is you are not having positive attitude, you are negative emotion and negative attitude, that will be terrible. You don't want that, okay? So keep the positive emotion be up. Positive emotion, so positive attitude up. So even negative emotion, you can fix that. Positive attitude is so important. Keep that in mind, okay? 嗱，各位堂友，如果你係糖尿患病者咧，你係已經有即係呢個憂鬱症嘅咧，係好多時咧，醫生好難走去話俾你有憂鬱症，因為好多時咧，當你係就嚟入到去呢個憂鬱症嘅時候咧，好多時咧你唔會唔肯睇醫生，唔肯去睇醫生。個原因就係因為你驚住睇醫生之後弊家伙啦，醫生話俾你我啲唔妥啊，乜唔妥啊，呢度病嗰度病。咁有啲人咧直情話唔想睇醫生啊，我驚佢第一話睇醫生要話俾邊度病啦，第二咧有 financial issue 咧，即係要俾錢睇醫生啦，同埋仲有好多不同嘅我身體部分又唔好啦，眼唔好啦，腎唔好啦，呢啲好多人咧唔想知啊，即係驚住呢個知道嘅 diagnosis 咧就弊家伙啦。咁其實好重要咧，你要有個真係有個 positive 啲嘅態度，即係積極啲態度，就幫助你有一個好嘅健康嘅選擇，幫助你選擇去點能夠醫治呢樣嘢。如果你有一個積極嘅態度，同埋有個正面啲嘅態度咧，咁你唔會咧 就話我唔醫啦 ，OK？ 因為你正面啊嘛，你積極啊嘛，咁你會一定去醫啦。嗱，就算你係好嬲嘅，你有個嬲嘅 emotion， 即係話我又死啦，哇！依家冇啊，有呢個糖尿病有冇搞錯啊？好嬲唔緊要，最緊要有積極同埋有 positive 有正面嘅態度咧。咁你會做嘢，你會 set 啲goal出嚟，你會有個即係目的，我一定要勝呢個糖尿病嘅，咁就 OK 啦。咁所以變咗嚟嘅，你一定係做到呢樣嘢咧，係會幫助你，好過你係哇，我係 give up 啦，唔得啦，就 negative， 即係唔係正面態度啦，仲有大家又要有唔係正面嘅嘅情緒啦，咁你就弊家伙啦。所以正面情緒、正面嘅態度係好重要，有積極態度做嘢。Okay, so the next question is, how are you going to prevent depression with diabetes? Okay, now very important, you have to always ask the doctor for a solid treatment plan, because if you create a right treatment plan, you know where to go because you already have a treatment plan. I will do this, and my blood sugar will drop down from 10 A1C all the way to 7 and then 6.5. And I will have goals to measure. Within 1 year, I will get this. So with that, it's so important because you have goal, you have track, your target to follow through. You will change your lifestyle to accommodate this. That becomes a very important step because I will do my exercise, I'll take my medication, I will drink Lowsutea tea, I will also control my weight. Even my big belly, I'll lower it. My BMI will be from 32, 34. I will drop it down to 25. That's my weight BMI, okay? So with that, you are now have a target to accommodate, to achieve, to lower your blood sugar. Now that will prevent you can become depressed because you see your progression, continue step by step. It's not really fast, but with step by step coming down slowly, you improve. And that becomes extremely important. Now, also, you have to seek a good endocrinologist, which is going to be able to measure and work together with you, measure your diabetes. Instead of just a GP, might not be, or family medicine might not be fully understand how to control. Now, some family medicine is very good. So you have to understand which family medicine doctor to help you, who is strong in treating diabetes and also able to give you mental health support, because that becomes very important because you are lifelong disease. At times you might be very depressed or, in some way, or you'll be moving to depression. You need someone to support you in that. And when you're diabetic goal, and with timeline achieve your blood sugar, your exercise, you jog it down every week. I did 150-minute exercise. My blood sugar goal is this and this and this. I will do 10,000 steps. And plus, at the end, I also join what? Diabetic support group. You know, I have a patient support group. So people come and talk about their problem. I can help them. Wow, that is so wonderful. Because that result that your patient support group will help you to gain those support and recognize all the problem you have, and that will sharing the problem and also getting doctors and maybe nurses to help you out. So then you become a big different support, then you will not feeling depressed. So maybe with that, then you can prevent all the feeling of depressed because you can share your problem with others. Oh, I didn't realize I'm only one, or other people have the same thing. Okay, then you can able to feel much better. You don't have all these pressure anymore. And plus you're getting solution from your doctors, your nurses, and your support group. So that will really help you to lower the chances to get depression. 嗱，點樣預防呢個糖尿病者感到沮喪咧？好重要，第一咧就係你個醫生同埋你護士啊，幫助你俾一個係好積極同埋好嘅即係treatment plan 俾你，即係有個醫治嘅管理成個系統性嘅計劃俾你。For example， 我要 A1C 由10至到6.5嘅，係點做咧？嗱，我會開始有 diet control 啦，即係食物嘅管制啦，我會做 exercise 1萬步啦，我會亦都減肥啦，近時係31個 BMI 啦，我會減到25啦，或者點減啊？慢慢減落嚟嘅。咁呢啲嘢全部咧就要寫低佢嘅，睇住。咁你睇下原來哇幾好喎！我1個月前已經係250磅嘅，我依家已經係230磅啦。2個月後，啊咁 very good 啦。咁一路做嘅時候咧，咁你就開始有 motivation 去做嘢嘅。咁同埋仲有咧，就要揾個好啲嘅即係真係嘅分泌科嘅醫生啦，即係內分泌醫生啦，即係 endocrinologist 啦。咁呢個內分泌醫生咧又好重要喎。點解咧？因為佢真係知道糖尿病係乜。嗱 ，Sunny 如果全科醫生未必係可以，因為佢未必有咁多專業嘅東西。嗱，如果你有個好嘅家庭醫生咧，可能得嘅，因為家庭醫生咧有好多係專業咧，好嘅，同埋亦都有家庭醫生亦都知道咧點去處理個咩精神嘅 support 好緊要。OK， 咁同埋咧仲係一定要 set 啲即係目的俾你。有時間性，幾時我係度啲糖跌到幾多，同埋咧我糖尿嘅水平喺呢度邊度有幾多，重磅要幾多，磅數要幾多，同埋咧我 exercise 要幾多，係咪一個月一日做1萬步啊，一個禮拜做150個分鐘嘅 exercise， 呢啲全部要知有目的嘅，咁能夠咧仲要咧就加入一啲叫做 support group 糖尿病嘅小組啊。咁大家你知道，我知道我同你差唔多嘅啫喎。咁我亦都可能夠你俾 support 我，係俾 support 你。咁呢個咧係一個好重要嘅。當你大家 share 同樣嘅問題咧，呢個同近時咧係唔同咗。你唔係 alone 嘅啦，你唔係自己一個人啦，已經。我係可能夠 share 我啲 problem 啦，我亦都揾到醫生同我解答到啦。咁你成個生活咧，因為呢個糖尿病一世嘅病嚟噶嘛。咁如果你係有好多 support 嘅話咧，你個人咧唔會好快去咗頹喪，亦都唔會好快去咗冇 hope。其實冇 hope 咧係對你個 depression 好重要嘅。如果你冇 hope 咧，即係冇咗期望啊，咁你咧就可能好快脆咧就變咗係 depressed， 咁你又好弊家伙啦。The most important with all these things we talk about, you have the goals, you have to see improvement. The best, most important is prevent you from depression is you have hope. If you have hope, you know what? You most likely depression will be the risk of getting depression minimized. You have to continue hope, see yourself continue goal to set to get yourself moving forward, see improvement, then you will have less chance to get depressed. Now, certainly, if you truly find out you do have depressed, so what are the common treatment will come by? Now, a lot of times that you can able to get therapy, meaning that you're going to have a psych therapy or nurse therapy, whatever the therapy that you can find or you will refer are several. It could be a doctor, it could be a psych nurse, whatever. And the important is they will talk about your feeling, to find solution treatment for you, and they will have a plan, and they may have family therapy. All those things are, part of the therapy or the therapist, if you will. And they will help you to at least get someone to talk to. It's so important. Now, certainly there's also medication, antidepressant drugs. That will be also helpful. But more importantly, you got to realize you got to manage stress, because stress increases your blood sugar level. Definitely it does. And then it will make your diabetic management become very difficult. So some of the tools of stress management is, for example, you have to do exercise. If you exercise, you let out those frustrations. You can do meditation, and you can get enough sleep. Because not enough sleep, you will be very, very detrimental for your stress, because you will go up. You don't have enough sleep, your stress go up. Your blood sugar goes up, and then you can become very stressful. You can be very grouchy and so forth. And then you can listen to music, soft music, and get you relaxed. Read some book. Some people watch TV, but do not get into alcohol or smoking, all the bad habits. Eating, don't do that. Get rid of that. So that will help you to definitely treat your depression. But if you are severe depressed, you do need doctor help, because that is not necessarily you can handle by yourself. 嗱，當你如果真係有鬱症嘅時候，你真係醫治嘅。點醫治咧？嗱，當然啦，醫治咧就會係有啲therapist 啦，即係呢個精神科嘅護士啊或者醫生啦，幫助你了解你自己嘅心聲啦、你嘅感受啦，同埋有咩能夠俾到你一個叫做醫治方法啦。好多時咧亦都有家庭醫治咧，即係同埋你屋企人一齊同你去點 support 你啦。有啲係好特別嘅，因為我有一個patient 有一個病人咧，佢自己咧就已經係好有問題㗎啦，即係佢自己成日好驚啊乜乜。最弊咧，佢屋企咧，佢啲家庭咧唔係俾好多 support 佢，猛鬧佢，係咪衰啦？你咁乜啦，咁佢更加差，所以咧就好弊。所以呢個咧就要喺方面咧，佢整咗成個 family 翻嚟嘅時候咧，大家喺個講座裏邊咧就 eliminate 嗰個屋企人咧去責怪佢嘅，咁佢就變咗咧就個人舒服晒，因為個屋企人猛話你，你搞錯啊，你自己攞嚟賤嘅啫，乜，咁佢越整講得多咧，越整個弊 ，OK？ 所以呢啲嘢咧係要真係有個 family therapy 會幫手。咁當然啦 ，medication 好緊要嘅，食藥咧就可以幫助你 antidepressant， 即係可以係一個，但唔係成日可以用嘅，你一定要醫治嘅。咁原來好重要咧就係個 stress management，stress management 咧就要將你 blood sugar 係能夠降低，如果唔係咧，你個呢個 stress 咧 blood sugar 唔會降低，日正差嘅。咁你都係要 exercise 啦，可能你要做下一啲叫做靜坐啊，同埋聽下音樂啊，睇下書啊，睇電視啊，或者睇啲好啲嘢，就千祈唔好飲酒啊，同埋食啲猛食嘢，咁又唔得嘅。OK， 咁呢啲咧就多數係最緊要嘅，即係多數人嘅 treatment。係會幫到你，但係好重要，真係要即係屋企人 support 啦，同埋你如果有個 support group， 呢個係會對你好有幫助嘅。So remember, make sure your family could also support you, because I have a patient, the family are not that supportive. Keep blaming him, yeah, that's your own problem, and they were making him angry, and they feel so guilty because it's not their fault really. But on the other hand, the family blame them because it's like, you did it yourself. And the wife is just yelling at them, oh, wow, that was terrible. So net result, they get even more depressed. So you got to get that together to fix the problem. And hopefully they will feel much better, because happiness will get you less chance of depression. Now, in summary, 10 to 15% of patients of diabetic might actually end up with depression. And depression is make it really difficult to help you to manage your blood sugar, because more you depress, more stress you're going to have, more blood sugar go up. So it also affect your mental health enormously. It's terrible. I mean, I continue with fear, anger, stress, all kind of feeling is not good for you. So manage your stress become extremely important. And you have to identify a symptom. That's why I gave you the whole slides. You have to take a picture, how's the symptom of depression. So you can early identify, you can seek medical help. Now, the problem is make sure to prevent feeling of depression is so important to establish a solid treatment plan. Because when you have solid treatment plan, you know what? Most likely you're going to have hope. You're objective. You will start measuring your solution. Is it workable, not workable? You keep working on it. You will keep working on it. So then that way you are continue working on it. You have less chances to get yourself overly stressed out, because you are now seeing the progress. You will start seeing the improvement. So the attitude will change. And so treatment depression usually also come with, like, could be a potential psych therapy, could be a nurse, could be a doctor. So you're able to talk about your feeling, your problem. The medication, antidepressant medication will be helpful. But more important, you have the stress management. The stress management is basically, you have to make sure that you do exercise, you have to have meditation, you can read a book, you can watch TV, listen to easy music. Those are the things that you have to continue to work on together, so you can decrease the stress, so your blood sugar can be well maintained in a good level. 嗱，各位朋友， 記住10至15% 嘅糖尿病人咧係會 end up with depression。depression 咧係一個好大問題，因為如果 depression 咧就會 increase stress。咁當你有壓力大嘅時候咧，你嘅糖一定高，咁就好難去控制你個糖尿病嘅。咁變咗嚟講咧，第一樣嘢即係 manage 要管理個壓力啦，俾佢唔好即喺度上嚟啦。所以我頭啲咧有張 slide 俾你咧，就係令到你睇到乜嘢叫做 depression 嘅憂鬱症嘅症狀，好似瞓唔到覺啊、hopeless 啊、會想死啊啲，哇！呢個好弊嘅，所以一定要了解知道之後咧，就要揾醫生嘅幫手，或者揾家庭幫你 support 你啦。咁同埋仲有咧，就要繼續咧係去注重點去treat 你嘅糖尿病，因為有個叫 Diabetic Distress 咧，即係你係有個糖尿嘅困擾病咧，會令到你成個人都好唔妥，就好 stressful。但係你醫好糖尿病咧，呢個就會prevention 嘅。咁但係咧，仲要咧要唔好俾你去即係變咗個糖尿病，即係令到你會繼續去 depress 啦。咁好重要咧，當你唔會 depress 咧，點樣咧？係一定有一個好嘅treatment 嘅高或者你有個 solid 即係一個好實際嘅醫治嘅目標啊。當你有目標，人就睇到自己會一路進展咧，咁你嘅 chance 個 depress 咧就唔會高嘅。咁就算如果真係 depress 咁點算咧 ？treat 嘅時候咧就係第一，你可能會有呢個憂鬱症嘅醫療醫治啦。咁呢個係可能醫生或者護士呢兩個方幫你啦。咁仲要咧就係食藥啦，可能呢啲 anti-depressant 嘅 medication 啦。咁就係壓力嘅管制好緊要。有可能要做 exercise 啦、睇書啦、聽好啲嘅音樂啦。呢啲嘢全部咧都係幫助。仲有一樣嘢，好在飲去糖茶。當你飲去糖，即係降低你血糖，繼續幫助你降低血糖。所以呢個咧係一個好重要。當你飲咗血糖茶之後，你降低血糖嘅時候，你個整體身體都好啲嘅。OK， so very important. Make sure doing all that. Don't forget to drink your Lowsutea to lower your blood sugar, let you continue to be better, lower blood sugar, so your overall seeing the result are much better, so you can have a much better health outlook. Okay, so I hope today, sorry about a little overrun about a few minutes here. I hope today you can able to get a better feeling what is diabetic depression and know what to handle and what the sign and symptom look at it. And you look at it, then you can able to early identify what is depression and look at the signs and symptoms so you can seek professional help early, because it will, if you don't treat it, it will just get worse. So I don't know if you have any questions from the group which I can help you to answer. And maybe you can type it in and I can help you. 各位同學或者你睇有咩問題咧問我啦，咁我哋希望去答你啊。嗱，其實咧真係咧，如果係講depression 咧，係好多時咧，亦都有啲好多朋友咧係淨 ignore 咗，唔知道有咗呢樣嘢。咁其實一個係危險嘅，因為咧如果你唔知道嘅時候咧，你一路落去嘅時候咧，可以 end up 咧 not reversible 嘅。I want to alert you folks, depression, you don't want to get worse, because when you get worse, it really become unreversible. You will just get worse, worse, worse. So, the important is identify early so you can seek a professional help. And it's not good to wait till too late. Then you start getting to say, I'm total give up hope, and it's not going to work. And when that happens, it will take a long time to actually, to change that and become deeper and deeper, and that become extremely difficult to get well. And that's the sad part. I noticed a lot of the people who have that problem and end up, I talk to them like hours, half an hour to 1 hour before I can actually change a little with them. Then they become, start seeing the light to say, okay, I can able to see some a light that I know I can work with. And we make goal, not big goal, tiny little goal, so they can achieve. 其實我都同好多堂友傾咗啦，咁佢有啲唔妥啊，有啲 hope 冇 hope 嘅時候咧，咁我哋 set 好細嘅高俾佢，即係細嘅目標俾佢一路慢慢長，咁先能夠令到佢係轉變咗成個心理上嘅問題，係一個好難嘅東西嚟嘅嚇，記住，所以 not so easy。所以記住咧，如果一有 depression 咧，早啲處理，唔好等佢遲。OK。So, are there any questions? If there are no questions, I appreciate all the time that you spend with me. Talk about possible how to prevent diabetic depression. I appreciate all that help. If you are okay with that, you make sure to give me a like in the Facebook, people in the Facebook, and give me a note there and say, great, this is a good lecture. Give me some feedback. Or in here, you can on the chat, you can say, this is good. So I can know this is something that we're doing right things for you to listen, to learn. And I appreciate it. If that's the case, I appreciate your time to participate. Now, next week is a very important time for many of you might be in US. For Hawaii, next week, we're going to have a panel discussion with 3 doctors. One is Professor Jane Yeung. We talk about diabetic eye, so we learn about what it is a diabetic eye. That will be a tremendous good lecture to listen. So with that, they will lead into what is a pre-diabetic, how do you prevent pre-diabetic, or you're diabetic, how to prevent a diabetic complication. So again, though there are 3 doctors talk about the whole program. It's going to be 3 p.m. Hong Kong and also Hong Kong and Philippine time, South Asian time. For US customer, like Hawaii customer, that will be at 9 p.m. your time. 9 p.m. We will send you an invitation, but you gotta keep that in mind. This is going to be really good. It's extremely hard to get all these right doctors, professors to talk about. So it will be beneficial for you. So we met next week. We will make it at 9 p.m. Hawaii time on 29th, 9 p.m. Hawaii time. For Hong Kong will be the 30th at 3 p.m. Hong Kong and Philippine time is 3 p.m. On the 30th. Okay. So thank you very much. I'm looking forward to talk to you next week. It will be a wonderful, exciting, a very well educational webinar. Take care. Thank you. Bye-bye.